We would like to inform you about a new technique for the use of local anesthesia when performing endometrial ablation. Recent research conducted at Máxima Medical Center has shown that patients experience less pain when paracervical anesthesia is combined with fundal anesthesia for the NovaSure treatment. In this video, we will briefly explain which steps you need to take when using this technique yourself. We advise having the patient take 1,000 milligrams of paracetamol and 500 milligrams of naproxen 1 hour before the procedure. During the procedure, we recommend to have at least one nurse to assist you, and the presence of a second nurse to supervise and reassure the patient. Once the patient has taken their place in the examination chair, you will start to perform a transvaginal ultrasound to assess the position of the uterus and to get an impression of the size of the uterine cavity. Next, insert a pre-warmed speculum and disinfect the vagina and cervix, for example using Hibicet. Firstly, inject 1 ml of ropeyvacane in the anterior lip of the cervix and then position a tenaculum in order to manipulate the cervix in the required direction for the injections of the paracervical block. For the paracervical injections, we recommend to use a spinal needle. To avoid advancing the needle too far, cut off a piece of the needle's sheath so that it is about 1 centimeter shorter than the needle, and then place the sheath over the needle again. Now perform 4 paracervical injections of 10 ml of ropeyvacane each, at 3 o'clock, at 9 o'clock, and at each of the uterosacral ligaments. It is important to briefly pull back the plunger of the syringe in order to check whether the needle hasn't accidentally punctured a vein. Next, remove the tenaculum and the speculum. Then perform a vaginoscopic hysteroscopy to inspect the uterine cavity and administer the fundal block. For this, it is recommended to use a Williams cystoscopic injection needle of the Cook Medical brand. Now perform another 4 injections. 1 injection about 1 centimeter medial to the tubal ostium on each side, plus 1 paramedian injection on each side. If the endometrium is quite thick, make sure the needle actually reaches the myometrium. It is important to fix a stopcock to the injection needle and to close that stopcock after each injection. Next, remove the hysteroscope and wait for about 10 minutes to get the anesthetic to work properly. Now you can perform the NovaSure treatment. Consider doing another hysteroscopy immediately after the NovaSure treatment to review the ablation effect. If you are unable to pass the cavity check or if the patient's pain level seems to be worse than expected, a hysteroscopy will be advisable. During the first 12 to 24 hours after treatment, we recommend that the patient take 1,000 milligrams of paracetamol once every 6 hours and 500 milligrams of naproxen once every 12 hours. Our randomized trial showed that women who received the combination of paracervical anesthesia and fundal anesthesia experienced less pain during the procedure than women who only received paracervical anesthesia. For the full study results, please refer to the published article.